Okay, Running Shorts is here with Dr. Bert Fields, a Greensboro resident. He is the director of the Sports Medicine Fellowship with the Cone Health Systems and is a lifelong runner. Dr. Fields is the 100th runner being featured on the Running Shorts blog in the Friday Runner series. And I just wanted to ask Dr. Fields for your best advice for new runners.
Well, my best advice for them is to go slow and get with a program where people who have been through this can help you get started on a gentle progression to where you can train steadily.
Okay. During the course of your career, you've treated lots of patients. How many patients would you estimate you've treated?
Well, it's interesting. I did a little survey on my patients in a given year. Now, I may see, right now, part of my time is teaching, but I still may see about 3,000 patients in a year. Half of those were runners in 1 year.
Right. What are the most common types of running injuries that you've had to diagnose during your career?
Well, one thing that's extremely common would be Achilles tendonitis, or tendinopathy is the term we use in sports medicine these days, but runners are about 30 to 50 times more likely to get that than people who don't run, so it's a real common running issue. The second would be anterior knee pain, what a lot of people call runner's knee, and it's extremely common as well, partly because the hamstrings get a little too tight with running and the quads don't get enough work a lot of times. The third would be the myriad of problems we see around the feet, particularly plantar fasciitis, stress fractures, and metatarsalgia, which is an irritation of the forefoot.
What is the most unusual injury you've had to treat during your career?
I'm glad you asked that because we got the prop for this. I wanted to show you. This patient will probably recognize this if she sees the blog. But a patient came in complaining of foot pain, and this is a little nut that was embedded in the bottom of her shoe. So I asked to look at her shoes because I couldn't figure out what her foot pain was, and it's worn smooth where she was landing on this. We took this out of her shoe, and miraculously her foot pain disappeared, an instant cure.
Great. How about as far as the most gruesome injury that you've had to treat in your career?
Well, I've seen, and it's amazing how tough people are, both at Boston and at the Marine Corps Marathon. I've seen people with a complete through-and-through femoral fracture. That's the big bone in your upper leg. Complete fracture through and through. Both of them finished the marathon.
Wow. All right, and the best part of your job as a doctor?
It is extremely rewarding when you sit down and work with someone and they've got a problem that's keeping them out of running. And you can figure out a few little things to help them rehabilitate it, do the right things to settle down the inflammation, and they go back and have some great success.
That's great. All right, Dr. Fields, thank you for helping runners, including me, and thank you for your time.
It's been a pleasure.